Similar to the medication aspect, most institutions will probably have a similar set of items in their crash cart. There will be some differences, and that kind of depends upon the institution's specific needs, specific situations, and what might be available readily, maybe on like patient care floors. You can pretty much count on syringes, saline flushes being available for the purpose of administering medications. You also see IV placement sets, both for peripheral access as well as typically central access as well too, so central lines. You can expect airway and respiratory equipment. This would include what's called bag valve masks. So that's like if you watch like the emergency medicine shows, that's when they have like the face mask over the patient and someone is actively squeezing the bag. As well as intubation kits, so we can put a endotracheal tube, an intubating tube down someone's airway, as well as what's considered supraglottic airways, which would be a LMA, also known as a laryngeal mask airway. Also, we need to consider our own personal protection. So typically in a crash cart, there'll be items in there to protect us as healthcare workers as well too. This would include gloves, gowns, as well too, masks with shields as well, because as healthcare providers and resuscitators of the patient, we need to prevent, blood-borne infection transmission, etc. We'll also see fluids, bags of sodium chloride and dextrose in the carts that we can either use to give patients boluses, as I mentioned before, maybe with cases where someone might have been dehydrated or maybe lost blood to kind of help increase the amount of fluid in their vasculature, as well as to use to compound or make medications on the spot, such as maybe like epinephrine bags so we can bring the patient's blood pressure back up. Also can expect other aspects such as maybe a sharps container to throw away any used needles and sharps into some location, and other items too, as you might expect, such as tape, gauze, etc.